It's time to acknowledge the sickest patient in the room. We're talking about healthcare. Just look at the chart. Every year, employers brace themselves for rising healthcare costs. These increases outpace inflation. They reduce profitability and hurt the bottom line. Now, consider your own situation. You might have made multiple changes to your company's health plans over the last 5 or 6 years, but the hoped-for improvements just aren't delivering. Everybody knows we can't go on like this. And fortunately, we don't have to. There was a time when today's fee-for-service insurer-provider relationship was a trust-based doctor-patient relationship. Primary care was a proven model with lower costs and higher patient satisfaction. So what if we could get back to that? That's the revolutionary idea of DPC Healthcare. Take what used to work, apply modern innovation, and forge a new model for wellness. It all starts with the doctor-patient relationship. In an insurance-based model, you have to see a doctor in the clinic so the doctor gets paid. Then, just to make a reasonable income, the doctor has to see a lot of patients, 20 to 30 a day. That breaks down to only 7 to 12 minutes per patient. So when patients do get their scheduled time, they're hopping onto the doctor's treadmill. In the fee-for-service cycle, important questions and concerns go unanswered. Prescriptions and referrals become default go-tos for staying on schedule. Deeper issues go unaddressed. Dissatisfied patients abandon regular checkups, and you get the idea. DPC Healthcare breaks this cycle with a much lower ratio of patients per physician. Each patient enjoys true 24/7 physician access, including in-office visits, home visits, phone, text, email, video conferencing, and online appointment setting. With that access comes personal attention and an ongoing knowledge of a patient's medical history. The doctor doesn't just come in with a clipboard, but with a fully developed healthcare plan. The best part? 90% of all the patient's medical needs can be met by the primary care team. When specialists are needed, the core relationship still resides with the primary care doctor, meaning that one person maintains true oversight of the patient's well-being. Of course, this is better for the patient, but it's also better for the one shouldering most of the health plan costs, the employer. Consider a visit to the ER. Too many patients go this expensive route, thinking it's their only option for immediate medical care. However, if you replace the ER trip with a text, video chat, phone call, home visit, or visit to the DPC Healthcare office, the direct cost savings are threefold. And for other high-cost drivers like hospitalizations, MRI and CT scans, surgeries, specialist visits, studies show vastly improved numbers under direct primary care. There are also indirect savings. With patient-centered direct primary care, your employees are more engaged, more likely to trust their doctor, and more likely to adhere to treatments now provided by their doctor. This reduces your risk pool, reduces absenteeism, and increases employee satisfaction. DPC Healthcare is all-inclusive primary care, provided at a set, low monthly fee. Patients enjoy unlimited 24/7 access with annual physicals, routine lab work, routine immunizations, minor procedures, routine therapies, and oversight of hospital visits and specialists. There's no rising ticker with added pay-per-service charges. Regardless of the number of visits, the monthly fee is always the same. There are no additional fees. Effectiveness and savings go hand in hand. Because your employees have unlimited access to direct primary care, you can reduce your insurance package and premiums, paying only for the large-scale critical coverage that insurance was originally intended for. It's an approach that lowers your total healthcare expenses by up to 30%, plus a happier and healthier workforce. DPC Healthcare. Increased access, team-oriented care, efficient management, healthier employees, lower costs, better care. This is your cure for an ailing system.